Hi, everybody. Welcome to the latest MA Live, brought to you by Modern Athlete in conjunction with our sponsor, Traumeel, your reliable running partner. Traumeel is all about inflammation, and inflammation is natural, so it's a good thing. Traumeel is a multi-target, multi-component medication that alleviates inflammation symptoms, helping you to regain your normal mobility and activity again. You get it in cream, gel, tablets, or drops format at your pharmacies and other health stores, so check it out. Now, today, as part of our Learn to Run Well series, we are talking to Dr. Fezile Mkhize, or Fez as he is known to his friends. Some of you may recognize him as a top billing presenter on television. Some of you may have seen him taking part in the Mr. South Africa pageant and going on to the Mr. World pageant. And he did very well at all levels in that. And of course, what some of might not know, on the other hand, is that he's actually a medical doctor, and he's currently in training to become a surgeon, specializing in the cardiothoracic direction, which means hearts, lungs, and the chest area, which makes him eminently qualified to discuss colds and flu and all that kind of stuff today. So Fez, first of all, welcome to our MA Live session.
Thank you so much for having me. I feel like that was way too.
I probably do not deserve it, but here we are.
Well, let's put it this way. We only talk to people that we like and we think can add value to the listeners and the readers out there. So thanks for joining us. Thanks for making the time. I just want to point out to viewers that load shedding is, of course, a factor in all of our lives, as we all know. And the quality of these recordings is sometimes can be affected by that. So please bear with us if there are little stumbles every now and again. So Fez, first things first. It's what we call the cold and flu, listen to me, the cold and flu session. Winter has arrived, it's cold outside, it's a bit wet. Is this literally what the doctors refer to as cold and flu season?
Well, yes. Oddly enough, it feels like it is when we see the most cases, so we dub it that just because of the prevalence of the sniffs and coughs and the aches and pains. And that can actually be a predominant result of us being more indoors. So what happens with any sort of virus, flu, colds, is that it's spread with the interactions that we have. And generally in the winter, when it gets colder, what happens? Everybody kind of comes together and there's that interaction between all of us and that nucleus. And we touch things, and the people that are sick touch things. We touch the things they touch. We have closer proximity because we're indoors. So that freedom, that movement, that roaming that generally happens in the warmer seasons tends to not happen, which means that the situation is right for us to spread things that are kind of contracted through surfaces and kind of mucosal areas that are coming into contact with those viruses.
So we're actually our own worst enemies by keeping warm and hanging out with each other. We make each other sick.
It's the irony of it. It's really funny because it's like if we were outside more and running around, we'd probably see far less cases. But because that's not the case, we see more cases. That's why we end up dubbing it the flu season. And people go, well, does winter kind of just create the flu? And then the flu goes, oh, it's cold. Let me run away because now, it's warm. Let me run away. The warmth isn't good. It's more because of how we behave and our behaviors as humans.
So that brings me to a related question, which always comes up in running circles. It's raining outside. It's cold. I don't think I should go running because I'm going to get sick. So what you're saying is it's got nothing to do with how cold it is or the fact that it's raining.
The cold element is the environment that ends up causing us to be in that situation, rather than the causative issue that then ends up making us sick. So yes, of course, we always say keep warm, make sure you wrap up, all of those good things. But the likelihood of you getting the infection is because of the things that I've mentioned, rather than you being outside in the cold. And hopefully you are wrapped up. But even if you are shivering a bit, it's not necessarily the thing that's going to give you the infection.
So on that topic, then, the fact of getting wet if you go running in the rain, does that give you the sniffles? Is that a cold versus getting a flu bug?
So when you go out and you actually get the rain, the cold, the wetness, what happens with your body, especially when it comes to kind of temperature regulation, and a lot of people will talk about like, oh, okay, I'm getting cold, maybe my core temperature drops. Generally, the body preserves your core temperature quite well. It's the peripheries that end up getting quite cold when it comes to the wet and the less favorable temperatures, and your body ends up shaking, your body ends up going through the processes it needs to try warm up those peripheral structures. What that then does is that it does to some degree affect how your immune system now regulates itself, especially over extended periods of time. What happens is that you have a decrease in terms of your blood flow because the peripheries the blood vessels actually end up narrowing. They're not as kind of wide. There isn't lymphatic flow when it comes to how the immune system and kind of that structure works. So you end up having a diminished immune protective kind of element to yourself, and that then ends up making you more likely to have infections then become full-blown infections because your immune system is diminished in that way. So as you can see, it's kind of like not that you're going to get a virus because of it, but your immune system is going to get affected, which makes you more likely to get viruses that are there, because those viruses are now more likely because you'll be inside, indoors, doing all of these other things. That means that your body won't be able to buffer it as well as it would.
On a related note, people always talk about topping up on vitamin C, which is to increase your immune system. Is that right? Does vitamin C really make such a difference?
It does. So vitamin C is an antioxidant that your body actually utilizes quite well. It also helps with kind of collagen production, which then goes into bone, teeth, etc. Which is why when you were out back in the day and you weren't eating your oranges and you get the scurvy and the teeth are falling out, it's kind of that decrease when it comes to that collagen element, so the bone and the teeth. That's where people would come in with kind of the infections that are there. One, because the immune system uses it as well to kind of buffer it and strengthen it. And two, the strength when it comes to the density of the bones and the teeth involved in that as well. So you have that as kind of the sequelae of you not having vitamin C. So if you imagine that when you take vitamin C, that means that you're bolstering your immune system and all of those other things that collagen is needed for, bone, teeth, etc. So the thought process after studies, or with studies having been done, is that vitamin C doesn't prevent you getting infected, but it actually shortens the time frame in which you are infected. So they found like an average, if somebody would get sick maybe 12 days in the year with an influenza or flu, taking vitamin C in the dosage of 1 to 2 grams a day will actually diminish that to about 11 days, maybe 10 with some cases. So it actually allows you to recover quicker, doesn't necessarily stop you from getting the infection.
Okay. I must admit, I don't think we've ever discussed scurvy before on this channel. So that was an interesting direction to go.
It's always like, it's always interesting to like hook concepts onto things that you've kind of heard about. And you go, oh, scurvy, lack of oranges. That's why oranges need to be there in the ships. And I always go, like it's a pirate thing, because I always imagine pirates is walking around there without any teeth. And they've got all of these like the gingivitis and the gum issues, but it's a good concept to kind of get, so that when you think about vitamin C, think about it bolstering bone, teeth, and then also the immune system when it comes to inflammation and all of the things that they suffer as a result of the scurvy profile. Okay.
No, I mean, I remember learning about scurvy in school when we did history lessons about sailors exploring the world. So thanks. I didn't see that one coming, but thanks.
So now, always keep you on your toes, Sean.
Oh, very much. So the next question runners often ask is to do with the fact that when you do get either a cold or the flu, can you still run? Can you still train? Can you exercise? Can you exert yourself? There's I don't know whether it's an unwritten rule or even a written rule, but a lot of people have for many, many years said that if the cold and flu symptoms are sort of above the chest, sort of from the neck up, you're okay. But as soon as it gets into the chest, you should not be training, running, exerting yourself. Is this true?
Conceptually, it's very difficult to differentiate, kind of, because whenever you look at it and you go, okay, there's rule of thumb things that you say in terms of, okay, above and below. And usually when it's above, you can kind of push a bit harder because you're assuming that it's an upper respiratory tract infection and a lower respiratory tract infection. That's what that kind of arbitrary way of thinking about it is. And with lower respiratory tract infections, those do tend to be quite severe because those could be anything from a pneumonia, bronchitis, even a TB could all kind of be classified under that that umbrella. And those are things where we go, well, we don't want you doing that because that affects how much your respiratory kind of system is working and your oxygen uptake, as well as then, of course, an implication when it comes to the heart. And then people will go, oh, if it's upper, then that means it's more like sinusitis. And maybe that's just something that could be kind of kept to this local space as opposed to the one lower down, which will then be a systemic thing. Generally, what I say to people is this: if you are feeling sick, even if it's up here, if it's you now are congested, if you're very runny, if you feel like the headaches are there, the eyes are quite watery, I always say just take your foot off of the pedal a little bit. Because what happens is that, especially when it comes with endurance performers, is over an extended period of time, working consistently, which is what you need to do to increase capacity and to also get the body acclimated to doing endurance, is that you end up potentially running the risk of putting too much exertion on your body, and thus your immune system, once again, winding back to that. And so your immune system's response to pathogenic, so things that are coming outside and trying to invade the body, becomes diminished. And that means that things that could have otherwise been contained, handled, and an adequate immune response given will then start to actually become something that's systemic. And people will say that that could be a physical manifestation of it getting into the lower part of your body, but it could also just be general aches and pains that started up with what felt like something that was above the head. And people would be like, that's an upper respiratory tract infection. So I always go, what you want to do is you want to actually scale back, be more into the recovery state. So do a lot more mobility, do a lot more of the stretching, make sure that you're optimized when it comes to the things that you're taking in. Water intake, incredibly important. The system that we work on needs water as a basis to have all the reactions and also all of the healing factors that the body needs to go through. So make sure that you're getting adequate amounts of water, get your electrolyte status right, and then make sure that you're getting adequate amounts of sleep. People almost arbitrarily say, okay, yeah, sure, sleep, because you imagine that you get your sleep, whether you want to or not. I'm always closing my eyes, I get to sleep, that's fine. But making sure that you're getting adequate amounts, and we always give the rule of thumb of 6 to 8, just because that's a study that's found. And of course, with newer studies, they found that some humans don't exactly need the full 8. Some could maybe go on the 5, but we always err on the side of caution or err on the side of the majority. And we say, get your 6 to 8, ideally 8, especially when you're trying to recover. And then you make sure that you're eating and getting enough nutrition. And what you then essentially do, of course, vitamin C, throwing back to that, things that are high in that, you then shorten the period of time that you're not feeling well. You make sure that you are not running the risk of exerting your body, which would then not only extend the period, but potentially make it worse. And in doing so, you then don't have to have the outcomes of you not being able to run because your body has all of those issues now. So we always say, slightly take your foot off the pedal, focus more on the mobility stuff, do your foam rollouts, all the things that you probably don't do enough of. Still maybe do anything from a moderate, like 90-minute or plus kind of a workout just to keep yourself conditioned, but you are just contracting the period of time that you are sick for so that you can then bounce back.
Sure, makes sense. I mean, one thing we see every year is people entering some of the big running events, be it the Comrades or the Two Oceans, the Cape Town Marathon, Soweto Marathon, or even some of the 10K and shorter races on the calendar. But it becomes their target race, and then they get sick just before the time because their immune system is a bit worn down by all the training and all that kind of stuff. And then they arrive at the start line either with just a cold or the sniffles, or sometimes even worse with full-blown illness, and they try and start races just to see how it'll go because they've paid for their tickets and their entries and their accommodation and their flights and everything, and they don't want to throw it all away. So we've seen some people end up with some serious side effects as a result.
So I had a colleague who actually was feeling a bit unwell, thought the same ideology in terms of, okay, it feels like it's a sinusitis, potentially a flu, had already booked the 2 oceans, was already really keen, was making good strides, felt very strong. So it was like, you know what, I'm going to risk it. And the thing is, they knew it was a risk because they knew that what objectively is the thing to do is to go, okay, no, this isn't going to be right for me, especially because what happens is runs like that, and I think he did the 56. So runs like that are an insult on the body. It's actually pushing the body and making the body have to perform at an elevated state. And that's why you find people who do the comrades days afterwards are at a lower immune profile. So you're actually more likely to get sick because you've exerted so much and your body's in that recovery state, because it is something that's very intense. So they went out, they ran, ended up, the infection actually became systemic, had to go into ICU, had to get some assistance in terms of some oxygen, had to get fluids, and literally right in the middle, just felt like their heart was irregularly beating. They felt like they were maybe running correctly. They weren't feeling any aches and pains while in the run, adrenaline, all of those stress hormones making you feel strong. But because they had that infection, because the body was already primed within an inflamed state, what can also sometimes happen when your body is in an inflamed state. So if you are sick, it can overshoot responses to things. So it's almost like it panics and it does too much because it's been slowly trying to figure out how to sort out this issue. And that's what inflammation is. Your body finds an issue and it sends out all the immune response cells and tries to kind of balance it out by increasing blood flow to the area that it thinks it has an issue. If it's systemic, it kind of sends out a whole bunch of antibodies and hopefully one of them will kind of stick. And what happens is that you can get states where you are now in an inflamed or hyper-aware state, and then you end up getting quite sick. So they ended up having that stint, not finishing the race. And it was a lesson in going, okay, yes, it's great. It's always good. The people who do endurance sports generally have steel will push through things, but it's also understanding that sometimes it's not just a will issue. Sometimes it's your body and how it's supposed to respond. And that response could potentially put you into a state that might, in the worst case scenario, end up killing you.
I unfortunately actually do have the experience of seeing that happen. A dear friend of mine ran with, it turned out to be glandular fever, not the colds and flu, but she didn't know it at the time and did so much damage to her heart. And unfortunately, she passed away. So yes, it's always good advice. Now, we've all been through the whole COVID pandemic and we all suffered through lockdown and saw our lives turned upside down. Since then, since we stopped wearing masks at the beginning of last year, and I think a lot of people have even forgotten about the fact that COVID is even a thing. Some people now say that COVID has literally just become the flu. You pick up a bug, you feel a bit grotty for a few days, maybe go to bed, maybe take some vitamin C or some other flu medication, and you carry on with life. In your experience in the medical fraternity, what's the feeling these days? I mean, I'm well aware that it's a contentious subject. Some people don't always agree with everything, but what's your experience?
I think and I think contentious is the best way to describe it, because I think what has happened, especially when it comes to that issue, COVID-19, it ends up becoming something that's also socio-political in nature. It's not just something that's necessarily science-based. And then it's, if you advocate for, say, a vaccine, people tend to go, oh, okay, what you are trying to do is take a stance like this, as opposed to, well, this is what we have found through the science of it, which is what, when it comes to anybody who's in spaces of science, so health practitioners, researchers, etc., all that they can really do is go, okay, this is the thing that we found has given the best outcomes and has been replicated this many times in studies. And this is the thing that we found through that outcome that can allow us to have those kind of positive outcomes replicated over and over and over again. And that should be as unemotional, as unbiased as possible. It should just be, this is what I'm presenting to you, and then you need to then make that decision. And decisions were made, of course, within governments, within the world spaces, because of what happened during that time. Things were frozen. We're trying to get on top of it. What I've found is that because of the nature of that, the socio-political element, people tend to either overly push when it comes to, okay, you should get the latest vaccine that we found, because the nature of what's happening is that the viruses will mutate, change, and then certain vaccines won't be as effective with certain strains, still cover you, but not be as effective with certain strains as others. And what's happened is that people tend to then go, okay, well, I'm not going to get this because I feel like this is the conspiracy, whatever conspiracy you want to pick from. And what I tell people is, look at the evidence that has come out, do your own research, because what happens is that I present to you what I've found has been helpful from all the studies I've heard, and these are the things that have rolled out. Just like when it comes to flu vaccines. So the flu vaccine, you get annual ones. Sometimes people will even say biannually. What happens is that there's flu vaccines, tons of influenza viruses, excuse me, and they all tend to mutate, which is why what happens is we have a whole collection of studies. We find within the studies the top, say, 3 viruses that are now found within the area. We give you an inactivated or an attenuated, a weaker version of that virus to then present to your immune system, so that your immune system can find those antigens, make the antibodies for in case you do get sick, so that when you do get sick, the body can mount an appropriate response where you don't even notice it. Or if you do get sick and you get some symptoms, they're very mild, and the body is able to get on top of it even quicker than it would if you hadn't. So it's less severe. And basically, that's how these things work. We find them, we figure out which one's most prevalent. We then have to attenuate the actual virus itself, and then give you those products and allow your body to respond. This is the same ideology that's happening with the COVID issue. We've gotten on top of it en masse in terms of now we are opened up channels, people can travel, but just as if there is a strain that might then occur and then it might spread rapidly, we want to always give people the option of going, okay, you can take this if you want to, because then that will help you augment all the things that are happening. But research is continuously occurring to make sure that the vaccines we give you have as far less a side effect profile as they can, and making them better than the vaccines that were given even before that, the beta phases, where we were really in an emergency state, trying to get on top of everything. So it was literally all hands on deck, trying to figure out a solution.
Sure, makes sense. You've actually answered the next question I had on my list then, which was basically the flu shot and should people get it, and you've explained why it's there, what it does. So I do believe it comes down to people making their own personal choice, but yes, it does make sense why it works. Yeah, sorry.
I mean, if the flu had become one, as I mean, it is quite widespread, but the symptomatology and the morbidity, so the mortality, excuse me, and the morbidity actually, if that was similar to what had happened with the COVID-19 issue, then it would have fallen onto, again, the bigger structures to make decisions that are going to affect the general population. And so then there would be instances where people would go, well, we are strongly telling you to take it. And so once the science of it, once the outcomes of it has been presented to both the people and the governments that run the greater population, we at the bottom are just there to ensure that they're implemented as safely and as well as we can allow that to occur, while being mandated by the governing entities that are there and the person who's coming in. because I always feel like you need to have your own autonomy. You need to make your own decisions, and hopefully the decisions you're making are off the back of your own research and speaking to people who are informed around the issue. We don't live in an ideal situation like that, but it's always, for me, the hope that that is what happens when it comes to any sort of medication that I give or any sort of treatment that I give.
Makes sense. So the last question I'm going to touch on today, I think is probably one of the most important questions when it comes to colds and flu and athletes running through it or running with it. And the question is simple. Is man flu really a thing?
Yes. Do not quote me as Dr. Fezile Mkhize. They quote me as Fez Mkhize. It is very true. No, you know what it is? It's interesting because I've seen some of the biggest, strongest, burliest males cower at the prospect of an injection, a needle. However, the gauge, the size of the needle doesn't matter. It's the concept of a needle entering into my body. It'll be me and you. I will close the doors. I will make sure that you can cry with just me and you there, and patient doctor confidentiality. You can walk out, your sons, your wife, they can all be there. And I'll be like, wow, what a sturdy, steadfast champion of a person. So it is very much what I have found, very subjective to the person. But yeah, man flu, I would feel, needs to be recognized within the medical fraternity as potentially something that needs further research than just going all humans suffer the same, and it's dependent on how severe, say, a viral load is or whatever it may be. I think males need their own kind of cohort, their own study, so that I can hopefully quote to you one day that somebody did find that there was a far severer case of man flu than just general other flus.
Have you ever had this terrible disease?
Do you know, I suffer from it, and I do find it can be quite debilitating. And it will be in a space where I will be with my partner, and I'm pretty sure we have the same thing. But for some reason, I can't get up from the couch, and she can, and she can cook and do everything in the house that I would usually do, but just my body doesn't seem to want to. So I think just on that basis alone, just from my own anecdotal assessment, I think it really needs more research.
So my fiance is in the background here laughing her head off at this at the moment, and she's yeah.
See, but would you not agree? I mean, what have your experiences been?
Well, I have to be honest. I am one of those people that I don't like being stuck in bed and saying, I'll go do the dishes. I'm quite fine. It's nice to keep my hands warm.
Listen, maybe it's different bodies, but I do find that there's a propensity in the male body for it to be quite a severe case.
Yeah, I know. Thanks for sharing the joke there. I couldn't resist asking that question.
Thank you so much.
Yeah, that's the list of questions I had. I hope that for the benefit of our viewers, discussing colds and flu, especially this time of the year where people are tending to be a bit more, let's say they're going down with it a lot more than they normally do. So thank you for sharing all of your medical knowledge with us. I am keen to ask one last question, and that's, how do you find the time to be a TV presenter and a model and a public speaker and an MC and everything else you do and do podcasts while still being busy with your medical training?
I always try to tell people that I can prescribe possibly the most optimized way of living for humans, because I feel like that's going to end up making sure that you live the best life and you don't see health practitioners as much. I might not fully adhere to the best way to go about, because for whatever reason, there's a 24-hour cycle. And within those 24 hours, the things you've described take up quite a lot of those times. And so My circadian rhythm isn't the most synced up. I think as a net, I do find that I do sleep adequately enough where I'm not necessarily getting sick or feeling wound down. But my mother says, while you can and while you're able, live as much life as you can, so that when you're older, you can look back and say that you took all the opportunities that you could. That isn't saying that you're going to live a balanced life, but I'm trying to optimize on all the things that I find interesting and things that I have been gifted with. So, yeah, not a lot of sleep, but a lot of heart, a lot of passion.
Does make a lot of sense. Fez, thank you so much for joining us. I really appreciate your time. As I say, I'm well aware of the fact that you're a very busy man. Just for the benefit of our viewers, we actually are recording this, well, today as I speak to you, but it was meant to have happened the day before, and Fez had to call and say, sorry, guys, I've been asked to rush into the office. So, you know, we all have those.
Sorry for that as well. Sorry. I think people just get sick when they want to get sick. I really thought they would. That's just, you know, sicknesses just jump on you.
Please, if there's one thing you don't have to apologize for, is the fact that you got called to the office for a medical emergency. So, Fez, thank you so much for joining us. Thank you for sharing that information. Once again, to our viewers, thank you for joining us. These are the MA Live, Modern Athlete Live Learn to Run Well sessions brought to you by Traumeel, your reliable running partner. We'll be having more sessions like this in coming weeks, so stay tuned on our channels, and we'll look out for the marketing for these sessions in the magazine and on our social platforms. Until the next time, Fez, thanks a lot, and cheers to all our viewers.